Kyler Rosencrans, and today I'm doing my visual aid speech on whether or not taping or bracing is better for athletic injuries. Have you ever been competing in a sporting event and ever rolled your ankle? Did the athletic trainer on site choose a tape or bracing injury? Well, for as long as we know, there's always been an ongoing debate on whether or not taping or bracing an injury is better than one or the other. The definition of taping is something that is fastened or attached to something with something that is adhesive. Some pros to taping are that it can be therapeutic and diagnostic, which it can show you exactly where the injury is. It can be a predictor for orthotic treatment, so if you're having a lot of lower limb injuries, you may need orthotics. It is less bulky and more agile and helps you move better, and is a lot more adaptive to your body. This is a picture from Priority Diary Today, which is a medical journal showing someone having their arches taped. Some cons to having injuries taped is that it is more expensive if you are continuously having your ankle or your wrist or something taped. It loses effectiveness very quickly. About 20 minutes into an athletic competition, the tape starts to loosen. It does not prevent injuries, so even if you have rolled your ankle previously and you have it taped for that competition, it doesn't prevent you from worsening the ankle sprain or breaking your ankle. And it must be professionally done by an athletic trainer. For instance, I work for the athletic trainer here on campus, and before competitions and before practice, we are constantly taping people and getting them ready for practices and competitions. And we have to be aware of tape cuts, blisters, and inadequate support. So we have to make sure that we are doing it right. Here's another picture of just your basic ankle tape. And from a medical journal done by Gary Wilkerson, he says that there's an abundance of research that indicates tape does not loosen, but I cite about a dozen or so studies that have shown that there is still a residual restriction. It still is adequate to prevent extreme displacement. So it is proving that taping does do what it's supposed to, but it's not saying that it is better than bracing. Bracing is strengthening or invigorating. Some pros to it are that it is inexpensive. Roughly a brace costs anywhere from $30 to $50 depending on whether it's for your knee, ankle, or wrist. And it is just one-time expense. You don't have to buy multiple unless it does happen to break over time. It is adjustable. You can adjust straps, you can tighten it, you can loosen it, and you can more than likely adjust the size. It is rehabilitative, so if, say, you tear your ACL, you have surgery, but then they instantly put you in a heavy brace and you can return to activity as soon as you are cleared, and it does not weaken your muscles, which is a myth. A lot of people think that wearing braces weakens your muscles, but it doesn't. It simply helps your little muscles on the inside of your body strengthen. Here's pictures of your basic ankle brace. A lot of people wear the lace-up braces like in volleyball, football, and basketball. And here's like your standard ACL brace. If you were to tear your ACL, that's what you would have after surgery. Some cons to bracing injuries is that they aren't as tight as they should be. They're not as form-fitting to your body part as tape is. And they lack flexibility and movement for athletes, so some movements are more restricted than others. Here's some more pictures of braces. Here's a more heavy-duty one for football players, and then here's an air cast, which is when you first sprain your ankle. If you have an air cast, that'll pump air into your ankle and prevent swelling. Some tips are do not tape or brace unless you are actually injured. A lot of people think that they're trying to prevent rolling their ankle and stuff like that, but like I said before, taping your ankle or bracing your ankle does not prevent injuries. Taping is, when you tape, you usually tape for a strained muscle. And bracing, you usually brace when you strain a ligament. And then I have a video clip talking about the difference.